Welcome back to the channel. In today's video, we're walking through 6 questions in the assessment section of the RBT test. Let's get started. Question number 1. During a break, RBT Sarah allows her client, Liam, to freely explore a variety of toys placed on the table without giving any instruction. She observes how much time Liam spends playing with each item. What type of preference assessment is Sarah conducting? A. Paired stimulus. B. Free operant. C. Multiple stimulus with replacement. D. Functional analysis. The correct answer is B. In a free operant preference assessment, the client is allowed to interact with items freely without demands or prompts. The RBT observes how long the client engages with each item, which helps determine preference based on natural interest. This type of assessment minimizes pressure and reflects more authentic choices. Now for the wrong answers. A is incorrect because a paired stimulus assessment involves presenting 2 items at a time and requiring a choice. C is not correct because multiple stimulus with replacement involves presenting multiple items at once and replacing chosen items in the array. D refers to analyzing the function of problem behavior, not preference assessment. Question number 2. RBT Alex presents 2 items to his client at a time and asks the client to choose one. He repeats this process with all possible item pairings and tracks how often each item is selected. What type of preference assessment is Alex using? A. Single stimulus. B. Free operant. C. Paired stimulus. D. Scatterplot analysis. The correct answer is C. A paired stimulus assessment involves showing the client every possible pair of items and tracking their choices. It's a structured way to determine which items are most preferred by comparing them directly. Now for the wrong answers. A is incorrect because single stimulus assessments present 1 item at a time, not pairs. Option B allows free access to items without requiring choices. D is a type of data collection method for identifying patterns in behavior across time, not preference. So option C fits the best, because choosing between pairs consistently points to the paired stimulus method. Question number 3. During an assessment, the BCBA administers a social skills checklist to a client. RBT Megan is asked to take data on whether the client responds appropriately to greetings from adults and peers during structured play. How is Megan contributing to the assessment process? A. She is conducting a functional analysis. B. She is assisting with a curriculum-based assessment. C. She is evaluating reinforcer effectiveness. D. She is developing the behavior plan. The correct answer is B. Megan is collecting data on the client's social responses using a checklist. This is a curriculum-based assessment, which helps evaluate current skill levels and track progress in specific areas like social communication. Now for the wrong answers. Option A is incorrect, because functional analysis looks at the function of problem behavior. C is not right, because Megan is not identifying reinforcers here. And option D is the BCBA's role, not the RBT's. In this question, Megan's use of structured tools to evaluate social skills is a clear sign of curriculum-based assessment. Question number 4. A BCBA asks RBT Daniel to help gather baseline data for a new client on self-care skills using a task analysis. Daniel tracks which steps the client performs independently during hand-washing. What type of assessment is Daniel assisting with? A. Functional behavior assessment. B. Social validity survey. C. Developmental or curriculum-based assessment. D. Preference assessment. The correct answer is C. Daniel is collecting data on a chain of behaviors, such as hand-washing, by breaking it into steps. This approach is typical of a developmental or curriculum-based assessment, helping the BCBA understand the client's current abilities and where support is needed. Now for the wrong answers. A is incorrect because a functional behavior assessment looks at problem behavior and its function. B refers to gathering feedback about the acceptability of interventions. D. Preference assessment is about identifying preferred items or activities, so note down that tracking progress on task analysis of daily living skills is key in curriculum-based assessments. Question number 5. A client frequently throws toys during play. RBT Julia is instructed by her supervisor to take ABC data over the next 3 sessions. She records what happens before and after the behavior each time it occurs. What is Julia assisting with? A. A paired stimulus preference assessment. B. A curriculum-based evaluation. C. A functional assessment procedure. D. A token economy system. The correct answer is C. Julia is taking ABC data, which stands for antecedent, behavior, and consequence. This is a common tool in functional assessments to identify what triggers and maintains problem behavior. Now for the wrong answers. A is incorrect because she's not presenting choices for preference. B is about skill development, not behavior function. How about option D? A token economy system involves reinforcement systems, not behavior analysis. Documenting the ABC pattern allows the team to identify behavior functions and guide effective intervention. Question number 6. RBT Omar observes that his client screams when given tasks, but stays calm during breaks. His BCBA asks him to record how often screaming occurs in work versus non-work situations over a week. What role is Omar playing in the assessment process? A. Conducting a discrete trial training program. B. Assisting with functional assessment procedures. C. Implementing extinction procedures. D. Running a preference assessment. The correct answer is B. Omar is helping identify patterns in behavior by tracking when and where it happens. This supports the BCBA in figuring out possible triggers and the function of the behavior. Now for the wrong answers. A is about structured teaching, not assessment. C is a specific intervention strategy, not data collection. And option D focuses on item preference, not behavior tracking. By comparing occurrences across settings, Omar is contributing essential data to a functional assessment process. And that wraps up all 6 questions of the RBT assessment section. If you want more practice, head over to our website with the link in the description to access free quizzes and mock practice tests. Be sure to give this video a like and subscribe to our channel for more practice videos. And we will see you in the next video.